Hello and welcome to Workers' Comp Unwrapped, the podcast that simplifies workers' compensation for physicians. I'm your host, Max, here to give you clear, actionable insights to navigate the medical legal side of workers' comp. So let's get started. Welcome to our fourth episode of Workers' Comp Unwrapped with Max. Meet Aisha, who has 15 years of experience in the workers' comp industry. Today we are talking about code right, get paid right, avoiding costly mistakes in medical billing.
Yeah, it's a jumble out there when it comes to medical billing codes. We're here to equip you with the knowledge and tools to navigate this complex world and avoid those frustrating coding errors that can lead to denied claims and delayed payments.
Okay, so let's unpack this. We all know that getting those codes right is crucial for getting paid, but for our listeners out there who might be thinking, coding, isn't that my billing team's job? Help us understand why this is so important for doctors themselves.
You're absolutely right that your billing team plays a vital role in this process. But think of it this way. Accurate coding is the foundation of your practice's financial health. It's how insurance companies understand and value the services you provide. If those codes are inaccurate or incomplete, it's like speaking a different language. The message gets lost in translation, and the result is often denied claims and delayed payments.
And those delays can really add up, right? Not just in terms of waiting for payment, but also in the time and resources it takes to resubmit those denied claims.
Exactly. It's like a domino effect. One small coding error can trigger a chain reaction, leading to a backlog of unpaid claims, disrupted cash flow, and ultimately a strain on your practice's resources. And we don't want that.
No. So it's not just about ticking boxes for the insurance companies. It's about protecting your practice's bottom line and ensuring you're compensated fairly for the important work you do.
Precisely. And it goes beyond just the financial aspect. Correct coding is also critical for compliance with regulatory guidelines. Mistakes, whether intentional or unintentional, can raise red flags and potentially lead to audits or penalties. It's not worth the risk.
Okay, so we've established that correct coding is crucial, but let's get down to brass tacks. Where do things typically go wrong? What are some of the common coding blunders that doctors and their billing teams need to be aware of?
One common pitfall is misusing ICD-10 diagnosis codes. These codes are incredibly detailed, specifying the exact condition being treated. However, with thousands of codes to choose from, it's easy to select one that's too broad or doesn't quite capture the nuances of the diagnosis.
So instead of coding for a specific type of ankle fracture, they might just code for a general ankle injury.
Exactly. And that lack of specificity can lead to denials. Insurance companies need to see a precise match between the code, the documented diagnosis, and the treatment provided.
It's like trying to order a specific type of coffee at a busy cafe. If you just say coffee, you might end up with something you didn't want. You need to be specific. Grande, non-fat, extra hot latte, please.
That's a great analogy. And just like that barista needs those specifics to get your order right, insurance companies need those detailed codes to properly process your claim. Another frequent error involves CPT and HCPCS procedure codes, which describe the specific services you perform. A mistake we often see is selecting codes that don't accurately reflect the complexity or level of care provided.
So billing for a brief follow-up visit when it was actually an extensive evaluation with multiple diagnostic tests.
Exactly. That's a form of upcoding, and it can trigger scrutiny from insurance companies. It's essential to ensure that the procedure code accurately reflects the time, effort, and resources involved in the service provided.
It sounds like the key takeaway here is precision. Taking that extra time to choose the most accurate and specific code can make all the difference in getting your claims paid promptly and avoiding potential headaches down the road.
Absolutely. Precision is key in medical coding. It's not just about getting close, it's about getting it exactly right.
Now, let's dive into another coding quicksand pit. Bundling and unbundling errors. Can you break down what those are and why they're so important to avoid?
Sure. Bundling is like creating a package deal. Certain procedures or services are typically grouped together and billed under a single code. Unbundling is the opposite, billing for those grouped services separately, which is often a no-no.
So it's like trying to order a value meal at a fast food restaurant and then charging separately for the burger, fries, and drink.
Precisely. Insurance companies have clear guidelines on what can be bundled, and straying from those guidelines can lead to denied claims.
So it's like playing a game where you need to know the rules to win.
Exactly. And the rule book, in this case, is the National Correct Coding Initiative, or NCCI. This resource provides detailed guidance on proper bundling practices.
So it's not just about knowing the individual codes, but also understanding how they relate to each other and when it's appropriate to bundle or unbundle them.
You got it. It's about seeing the bigger picture and understanding the logic behind these coding guidelines.
Okay, so we've covered some major coding pitfalls, but before we move on, I want to touch on something that often gets overlooked. The role of modifiers. These two-character additions to procedure codes might seem small, but they pack a powerful punch.
They're like the secret spices that can make or break a dish. Modifiers provide essential context and clarification for the services you've provided. Without them, the code might be accurate, but the full story isn't being told.
Can you give us an example of how a modifier might change the meaning of a code?
Sure. Imagine you're billing for a procedure that was performed by a physician assistant under a physician supervision. There's a specific modifier that indicates this scenario. Without that modifier, the insurance company might assume the physician performed the procedure themselves, leading to a denial.
So it's like adding a footnote to clarify who did what and under what circumstance.
Exactly. Modifiers are all about providing those extra details that paint a clearer picture for the insurance company.
All right, so we've talked about some common coding errors, but what can doctors and their billing teams do to prevent these mistakes from happening in the first place? What are some best practices for ensuring accurate coding?
Well, one of the most effective ways to improve accuracy is to invest in ongoing training and continuing education for your billing team. Coding is a constantly evolving field, and staying current with the latest guidelines and regulations is crucial.
So it's not just about hiring someone who knows how to code, it's about making sure they have the knowledge and resources to keep up with all the changes.
Exactly. Think of it as sending your billing team to coding boot camp, where they can hone their skills, stay up to date on the latest tactics, and come back to your practice ready to conquer those coding challenges.
I love that analogy. And speaking of conquering challenges, what role does technology play in improving coding accuracy? I mean, we live in a digital age, so surely there are tools out there that can make this whole process easier.
Absolutely. Technology is a game changer in the world of medical billing. There are amazing software programs and online resources that can automate many aspects of coding, minimizing human error and streamlining your billing workflow.
Can you get some examples of how technology can help?
Sure. There are coding software programs that integrate directly with your electronic health record EHR system. These programs can analyze clinical notes, suggest appropriate codes, and even flag potential errors in real time. It's like having a coding assistant built right into your system.
That sounds incredibly helpful.
Yeah.
Are there other technological advancements that are improving coding accuracy?
Absolutely. We're now seeing the emergence of artificial intelligence or AI-powered coding tools.
Yeah.
These tools use machine learning algorithms to analyze massive amounts of data and improve coding accuracy over time. It's like having a coding guru on your team who's constantly learning and evolving.
So the more they're used, the smarter they get.
Exactly. They can learn from past coding decisions, identify patterns, and even predict potential coding errors before they happen.
That's incredible. It sounds like AI is taking coding accuracy to a whole new level.
It really is, and it's just one example of how technology is transforming the medical billing landscape. There are also tools that automate claim submission, verify insurance eligibility in real time, and provide analytics to help you track denial trends and identify areas for improvement.
It sounds like embracing these technological advancements is essential for any practice looking to optimize their billing processes and avoid those costly coding errors.
I couldn't agree more. Technology is a powerful tool that can make a significant difference in the efficiency and accuracy of your medical billing.
Okay, Aisha, you've given us a lot to think about, but before we move on, I want to hear about a real-world success story. Can you share an example of how a clinic has used technology and best practices to improve their coding accuracy and see tangible results?
Absolutely. I recently learned about a clinic called Care Plus Health that was struggling with coding errors and denials. They were losing revenue and facing administrative headaches because of these mistakes.
I bet that was frustrating for everyone involved.
It definitely was. So they decided to make a change. They implemented an AI-powered coding system and a real-time claim tracking tool.
So they brought in the tech cavalry to help them out.
Precisely. And the results were impressive. Within just 3 months, their coding error rate dropped by almost 50%.
Wow. That's a significant improvement.
It really is. And as a result of those improved coding practices, the revenue increased and they were able to streamline their billing processes.
So it's a clear example of how investing in the right technology and processes can have a direct impact on a clinic's financial health and overall efficiency.
Exactly. It's a testament to the fact that even small changes can make a big difference.
That's a great story, Aisha. Thank you for sharing it. Now, I know that even with the best technology and training, challenges can still arise. Let's talk about the request for authorization, or RFA, process. What are some common challenges doctors face in this area, and how can those challenges be overcome?
One of the biggest challenges in the RFA process is ensuring clear and consistent communication between clinicians and coders.
The classic communication breakdown. Why does that happen so often?
It often stems from incomplete or ambiguous clinical notes. If the coder doesn't have a clear understanding of the diagnosis, the treatment plan, or the medical necessity for certain procedures, it can lead to delays or denials in the RFA process.
So it's like trying to assemble a piece of furniture with missing instructions. You're bound to end up with some extra parts and a lot of frustration.
Exactly. And that frustration can be avoided with clear and concise documentation. Clinicians need to ensure their notes are detailed and thorough, providing all the necessary information for the coder to accurately select the appropriate codes and justify the requested services.
So it's a team effort. Clinicians need to provide clear documentation, and coders need to be able to interpret that documentation accurately.
Absolutely. Open communication and collaboration between these two groups are essential for a smooth and efficient RFA process.
Are there any other strategies for overcoming challenges in the RFA process?
Yes. Staying up to date with constantly evolving coding guidelines is crucial. Insurance companies frequently update their policies and requirements, and if your coding practices aren't current, you're more likely to encounter delays and denials.
So it's a constant learning process.
It is, and investing in continuing education for your billing team is essential to ensure they have the most current knowledge and can navigate those changes effectively.
It sounds like being proactive and staying informed is key.
Oh.
Any other tips for smoother RFAs?
Absolutely. Implement coding software that flags potential errors as they happen. This real-time feedback can help coders identify and correct mistakes before they submit the RFA, reducing the risk of delays or denials.
That's a great point, Aisha. Catching those errors early on can save a lot of time and hassle down the line.
You know, one thing that often gets lost in the shuffle of codes and regulations is the human element. It's easy to forget that behind every claim, there's a patient who needs care.
That's a powerful reminder, Aisha. It's not just about dollars and cents. It's about ensuring that patients receive the best possible care, and that starts with accurate coding.
Exactly. Accurate coding is the foundation for smooth and efficient healthcare delivery. It ensures that patients receive the treatments they need without unnecessary delays or obstacles. It's about advocating for your patients, even in the complex world of billing and coding.
Well said, Aisha. Thank you for sharing your insights and expertise with us today. I'm sure our listeners are already feeling more equipped to tackle their coding challenges and ensure their practices are running smoothly.
It's been my pleasure. I'm passionate about helping doctors navigate the world of medical billing and coding, and I hope our conversation today has empowered them to take control of their processes and achieve greater success.
I'm confident it will. But before we sign off, I want to leave our listeners with one final thought. Imagine the sense of relief and satisfaction you'll feel knowing that your billing practices are optimized, your claims are being processed smoothly, and you're receiving timely payments for the valuable services you provide.
That's a great vision to hold on to. It's about achieving peace of mind and freeing up your time and energy to focus on what matters most, providing exceptional care to your patients.
Exactly. So listeners, take this message to heart. Invest in training, embrace technology, and commit to accurate coding practices. It's an investment that will pay dividends for your practice, your team, and most importantly, your patients.
And on that note, we'll wrap up the first part of our deep dive into the world of medical billing codes. Stay tuned for part 2, where we'll delve even deeper into this fascinating and ever-evolving field. You know, as we're talking about all this, I can't help but think about the pressure on medical billing teams.
Mm-hmm.
They're really the unsung heroes of healthcare, juggling complex codes, ever-changing regulations, and really the weight of a practice's financial health is all on their shoulders.
Yeah, it's true.
And speaking of juggling, let's talk about a specific area where things can get tricky: Modifier errors.
Ah, yes. Modifiers. Those two-character additions to procedure codes that can make all the difference between a clean claim and a denied one.
Yeah, they might seem small, but they're like the fine print in a contract. They provide crucial details and context that can completely change the meaning of a code.
So why do modifier errors happen so often? Is it just a matter of overlooking those little details?
Well, part of the challenge is the sheer volume of modifiers out there. I mean, there are hundreds of them, each with its own specific meaning and application. It's easy to get lost in the maze.
Sure.
Right. It's like trying to navigate a city with a map that only shows the major streets. You might know the general direction, but without those smaller streets and alleyways, you're likely to get lost. That's a great analogy. And just like getting lost in a city can lead to delays and frustration, using the wrong modifier or forgetting one altogether can derail a claim and lead to payment delays.
So it's not just about knowing the codes themselves. It's about understanding the nuances of when and how to use those modifiers correctly.
Precisely. Modifiers are all about adding specificity and clarity to your billing. They tell the insurance company the full story of the service provided.
So what are some practical tips for mastering modifiers and avoiding those costly errors?
Okay, well, first and foremost, education is key. Make sure your billing team is well-versed in modifier guidelines and has access to the latest resources like the AMA CPT manual and CMS guidelines.
So like sending them to modifier boot camp where they can learn the ins and outs of these crucial code additions?
Exactly. Ongoing training is essential for keeping up with the ever-changing world of modifiers.
And I imagine the technology can play a role here as well, right?
Absolutely. There are software programs and online tools that can help streamline modifier selection and reduce the risk of errors. Some programs have built-in prompts that alert the coder when a modifier might be necessary based on the procedure code being used.
So it's like having a digital modifier mentor guiding them through the process.
Exactly. These tools can be incredibly helpful for catching those potential errors before a claim is submitted.
That sounds like a lifesaver for busy billing teams. Are there any other strategies for improving modifier accuracy?
One simple but effective strategy is to implement a double checking system. Having a second set of eyes review the codes and modifiers can catch those small but crucial errors that might have been missed the first time around.
It's like having an editor proofread your work before you submit it. You want to make sure everything is clear, concise, and error-free.
Precisely. A fresh perspective can often spot those little details that the original coder might have overlooked.
And speaking of fresh perspectives, let's shift gears for a moment and talk about the role of technology in the broader medical billing landscape. It's a world that's constantly evolving with new software programs, online platforms, and AI-powered tools emerging all the time.
It's true. The pace of innovation in this field is incredible. And while it's exciting, it can also be a bit overwhelming for practices trying to keep up.
So how do you recommend doctors and their billing teams approach this ever-changing tech landscape? Is it a matter of jumping on every new trend, or is there a more strategic approach?
I definitely recommend a more strategic approach. It's not about chasing the latest shiny object, but rather about carefully evaluating your practice's needs and finding solutions that align with your goals.
Okay.
Yeah.
So it's like building a custom toolbox.
Right.
You don't need every tool under the sun, just the ones that are going to help you get the job done efficiently and effectively.
Exactly. Start by identifying your pain points, the areas where you're experiencing bottlenecks, inefficiencies, or errors. Then look for technology solutions that specifically address those challenges.
For example, if you're struggling with claim denials, you might consider a software program that helps you identify and correct coding errors before you submit your claims.
That's a great example. There are also tools that can automate tasks like insurance verification and claim submission, freeing up your billing team to focus on more complex issues.
It's about working smarter, not harder, right?
Absolutely. Technology should be a tool that empowers your team, not something that adds to their workload.
And as we've discussed throughout this episode, accurate coding is not just about maximizing revenue, it's also about patient care.
That's such an important point. When your coding is accurate, it helps ensure that patients receive the appropriate treatments and services without unnecessary delays or complications.
It's like making sure that the right medications are dispensed with the correct dosages. It's about patient safety and well-being.
Exactly. Accurate coding plays a vital role in maintaining the integrity of a patient's medical record, which is essential for providing continuity of care.
Aisha, this has been an incredible overview of the medical billing technology landscape. I'm sure our listeners are feeling more empowered to explore these options and make informed decisions for their practices.
I hope so. Technology can be a powerful ally in navigating the complexities of medical billing, and I encourage all practices to embrace its potential.
Now, before we get too carried away with all the amazing tech out there, I want to bring us back to the human element of coding and billing. At the end of the day, it's people who are making these decisions, inputting these codes, and navigating these complex processes.
That's a crucial point. Technology can be a fantastic tool, but it's only as effective as the people using it.
Exactly. So what are some ways that doctors and their billing teams can foster a culture of accuracy and excellence when it comes to coding and billing?
Well, one of the most important things is to create an environment where open communication is encouraged and valued. Clinicians and coders need to be able to easily connect with each other, ask questions, and clarify any uncertainties.
So it's about breaking down those silos that often exist between different departments and fostering a sense of collaboration.
Precisely. Regular meetings, check-ins, or even just an open-door policy can make a big difference in facilitating communication and ensuring everyone is on the same page.
That makes sense. Are there other ways to cultivate that culture of accuracy?
Absolutely. Providing ongoing training and professional development opportunities for your billing team is essential.
So it's not just about giving them the tools, it's about investing in their growth and expertise.
Exactly. By supporting their continuing education and encouraging them to stay current with coding guidelines, you're demonstrating that you value their skills and their contributions to the practice.
And I imagine that investment in their professional development pays dividends in terms of increased accuracy, efficiency, and overall job satisfaction.
Absolutely. And don't underestimate the power of positive reinforcement and recognition. When your billing team does a great job, let them know. A simple thank you, a shout out in a team meeting, or even a small token of appreciation can go a long way in boosting morale and reinforcing a commitment to excellence.
It's about creating a positive and supportive work environment where people feel valued and motivated to do their best work.
Exactly. And that positive work environment translates into more accurate coding, fewer errors, and ultimately a healthier and more profitable practice.
Aisha, this has been an incredible deep dive into the world of medical billing codes, best practices, and the crucial role technology plays in this ever-evolving landscape. I'm sure our listeners are walking away with a wealth of valuable information and a renewed appreciation for the importance of getting those codes right.
It's been my pleasure, and I want to emphasize that accurate coding is a journey, not a destination. It requires ongoing attention, education, and a commitment to continuous improvement.
Well said, Aisha. And on that note, we'll wrap up this episode of Workers' Comp Unwrapped. Listeners, if you've been inspired to level up your coding game, I encourage you to explore the resources and tips we've discussed today.
And remember, by investing in training, embracing technology, and fostering a culture of accuracy, you can transform your billing processes, protect your revenue, and ensure the smooth and successful operation of your practice.
Thank you for joining us, and we'll see you next time for another insightful episode of Workers' Comp Unwrapped.
You know, it's really, it's like building a house.
Yeah.
You need a strong foundation, and accurate coding is that foundation for your practice's financial stability.
Right, you got it. And just like a house needs regular maintenance to stay in top shape, your coding practices also require ongoing attention and adjustments.
Yeah, it's not a one-and-done deal.
Right,
you can't just set it and forget it.
No, you can't. So speaking of adaptations, let's talk about a specific area where staying ahead of the curve is essential. The world of technology.
Okay.
I mean, it seems like every day there's a new software program or AI-powered tool promising to revolutionize medical billing.
It's true. The pace of innovation in this field is, it's incredible. And while it's exciting, it can also be a bit overwhelming for practices trying to keep up.
Sure. So how do you recommend doctors and their billing teams approach this ever-changing tech landscape? Is it a matter of jumping on every new trend, or is there a more strategic approach?
I would definitely recommend a more strategic approach. You know, it's not about chasing the latest shiny object, but rather about carefully evaluating your practice's needs and finding solutions that align with your goals.
So it's like building a custom toolbox.
Yeah.
You know, you don't need every tool under the sun, just the ones that are going to help you get the job done efficiently and effectively.
Exactly. Start by identifying your pain points. the areas where you're experiencing bottlenecks or inefficiencies or errors. Then look for technology solutions that specifically address those challenges.
For example, if you're struggling with claim denials, you might consider a software program that helps you identify and correct coding errors before you submit your claims.
That's a great example. There are also tools that can automate tasks like insurance verification and claim submission,
Right.
freeing up your billing team to focus on more complex issues.
Yeah, it's about working smarter, not harder, right?
Absolutely.
Technology should be a tool that empowers your team, not something that adds to their workload.
And as we've discussed throughout this deep dive, accurate coding is not just about maximizing revenue.
Right.
It's also about patient care.
That's such an important point. When your coding is accurate, it helps ensure that patients receive the appropriate treatments and services without unnecessary delays or complications.
Right. It's like making sure that the right medications are dispensed with the correct dosages.
It's about patient safety and well-being.
Exactly. Accurate coding plays a vital role in maintaining the integrity of a patient's medical record, which is essential for providing continuity of care.
Aisha, this has been an incredibly insightful conversation about the intricacies of medical billing and coding. I'm sure our listeners are feeling more confident and empowered to tackle these challenges head on.
It's been my pleasure. I'm passionate about helping healthcare providers navigate this complex world, and I hope our discussion has provided valuable insights and practical tips.
Well, before we wrap up, I want to leave our listeners with a final thought. Imagine a world where medical billing is seamless and efficient, where claims are processed smoothly and payments arrive on time.
That's a great vision. And it's a vision that's within reach when we prioritize accurate coding, embrace technology, and foster a culture of collaboration and continuous improvement.
So listeners, take this message to heart. Invest in your billing team, embrace the power of technology, and commit to excellence in coding. It's an investment that will pay off in countless ways.
And on that note, we'll conclude this episode of Workers' Comp Unwrapped. Thanks for joining us, and we look forward to diving into another fascinating topic with you next time.
Thanks for listening to Workers' Comp Unwrapped. If you found value in today's episode, subscribe and share with fellow doctors. Stay informed and keep making a difference in your patients' care.